can you tell if your teen has anxiety or ADHD or both? Let's talk about it. I'm Dr. Tracy. I'm a board certified general pediatrician and I treat mental health conditions, especially in teens. So the first thing to remember is that there is a huge group on the internet that talks about ADHD in teens, and your teens are seeing it. So they're coming in droves wanting to know if why they are struggling in their life is because they have ADHD. I think the reason is because it makes it not their fault, which it's not their fault anyway. It gives them something they can do about it, and it allows them to get some resources that they might not be getting otherwise. Now, there are quite a bit of kids who ADHD is missed in younger years, and it is legitimately diagnosed in teens, but not near as many as we're seeing complaining of it and asking for testing. So why would your doctor test you for ADHD as a teenager, and why might they say not right now? The first thing is to remember is that ADHD symptoms should have been around since the toddler years. So we're going to do a pretty detailed history to talk to you about and your parent about, was this, struggles when you were in preschool? Did you have trouble sitting still, poor impulse control, difficulty focusing? Were you described as someone who was absent-minded? Did you struggle keeping things organized? Was there lots of emotional dysregulation? Things that occurred, was there any mention from teachers or anyone other than the child or parent with relation to some of these symptoms? If we only start noticing symptoms after the age of 12, it's really unlikely to be ADHD. It's not 100%, but it's more unlikely and more testing should be done before we just make that diagnosis. The second thing is, if there is untreated, documented anxiety in the teenager, it is really difficult to make a diagnosis of ADHD. And that's because anxiety can look a lot like ADHD, and you don't want to misdiagnose someone because putting someone on a stimulant medication who has anxiety could have detrimental effects. It's kind of like adding gasoline to the fire. It can make anxiety a lot worse and can cause unwanted side effects that don't need to be there. So a lot of times, even if we think anxiety could be driven by ADHD, we will sometimes address the anxiety first. Make sure the moods are a little bit more stable. See which symptoms get better. How much can the person manage their ADHD-like symptoms just with managing their anxiety? If it's still not working, then ADHD testing might be helpful and might be necessary. So I hope this helps a little bit. Some of the things we also talk about is your overall sleep hygiene. Teenagers are not getting enough sleep. They're not eating a good diet. They're not as physically active as they used to be. They're too much on their phones. So they are looking like they have more ADHD than ever. So we will push back a little bit and say, hey, what is going on in your life? Are you talking to a therapist? Are you managing your day-to-day life? Are you getting enough sunshine? What is your iron levels? So we'll do a really deep dive. So don't take this as that we don't want to help or that we don't want to diagnose with ADHD. We certainly don't mind, but we want to make sure we don't miss something else and just label you with something when there's something we could actually do lifelong to help you. If you have any questions, let me know.